Record. Hello, good evening, everybody, and welcome on this chilly Tuesday evening. My apologies for not being around last week, but last week you would not have heard me quite as clearly as you hear me tonight. And that's just a testimony to the potency of our products as well, because I had laryngitis last week, and I was not talking at all. And this week I can talk. So I might still have to take a little break every so often for some water, but we are here, we're back in business. And yeah, let's continue our chat that got really interrupted on the interaction between food and medicine. Obviously, I don't like medication. I do know it has its uses, and a lot of people rely on it. Specifically chronic medication for things like blood pressure and cholesterol and all those sorts of things. For me personally, I'm not a big fan of it. I know medicine has its uses. If you have a major infection, please use antibiotics. But as soon as you're over that infection, please get off the antibiotics. And put yourself on a good probiotic to regenerate all the bacteria, all the good bacteria that's been destroyed by that. But a lot of medication affects our body. And then what happens is we come along and we tell you, hey, you need to take some nutrition as well. And sometimes that nutrition can clash with the medication. And even from that perspective, our food. Because what the doctors don't tell you, and whether that's because they forget, or whether that's because they don't know, is that some medications clash with some food, meaning that the food can actually zero out the effect of the medication. And somebody asked me last week or last time, when is the best time to supplement? Well, once I get through this series, I'm going to cover exactly that. So bear with me while I go through this, because my next series will be explaining exactly when and how to supplement. But right now, we're going to continue where I left off last week about the interaction between medication and food. Pardon me while I just hide all of these bits and pieces over here. There we go. And shrink down everybody over here. So just to put it back into perspective, food and drug interactions, what to be aware of when taking medications, or scary enough, when going for surgery. Now, surgery does need to happen from time to time. And this happens if you're having to have like a joint replacement, a knee replacement, hip replacement, spinal surgery. Any sort of surgery will affect your system. And there are some precautions to take before going into surgery if you have that option. Unfortunately, there are some things like emergency surgeries. If you've got an appendix that's on the verge of bursting, you don't have the time to take the precautions beforehand. But if you know you're going to be having a joint replacement done in a month's time, or 2 months' time, or 3 months' time, you do have the option of sorting out your nutrition before that happens. So we covered a few things last week, and this week we're going to start off with antibiotics. Antibiotics definitely have their uses. And the last time I had antibiotics was because I was being a twit and working in the garden, and I got something under a fingernail, and I ignored all the science. Us people in the medical field are lousy patients. We make very, very bad patients, because we think we know better, and we think we don't respond to things quite the same as non-medical people. So that makes us get into trouble a little bit more often than other people, because non-medical people actually do listen and go and see somebody and get treatment. Now, antibiotics definitely have the uses. So when I had a little red stripe reaching pretty much the top of my arm, I knew I needed antibiotics. Now, that was 13 years ago. That was the last time I had. And it was a 5-day course, and that was done. So from that perspective, they work really, really well. If you happen to be having to have surgery for whatever reason, you will be put on antibiotics as well, which is a good thing. However, I do see sometimes, and I'm never going to argue with the doctor, they obviously have their reasons, but when I see people on a course of antibiotics, and then another course of antibiotics, and then another course of antibiotics, and they keep this up for a year at a time, I do tend to start asking questions. However, I am not a doctor. I am not a specialist. I'm not even a dietitian. So I am never going to question that with somebody else. If I am the patient, I will question it. But that is for another debate altogether. What we're talking about here is the interaction between medication, like antibiotics, and food. Now, this little graphic over here shows some natural antibiotics or antibacterials. Things like rosemary, ginger, echinacea, garlic, which has been my best friend for the last week, thyme, etc. Antibiotics are widely prescribed in medical practice. And I do see notices from time to time in medical journals and pasted up around the hospital for doctors' attentions to please limit the prescription of antibiotics if at all possible. Reason being is that antibiotics or bacteria can become immune to antibiotics. So then you develop these drug-resistant or multi-drug resistant bacteria, and that is purely because of overprescription of antibiotics. Many of them induce or are subject to interactions that may diminish their anti-infectious efficiency or, worse, elicit toxic effects. Food intake can influence the effectiveness of an antibiotic. You need to avoid co-administration of antibiotics with milk products, which are rich sources of divalent ions, such as calcium and magnesium, that complex with some antibiotics and prevent their absorption. So here you are, you've been prescribed this course of antibiotics, but you have a bowl of cereal in the morning with a cup of milk, or you just decide you like milk, so you have a glass of milk. You've just zeroed out the antibiotic. So in other words, it's as bad as quitting a course of antibiotics mid-course, which on that subject, never, ever, if you're prescribed a 5-day course of antibiotics, please complete the 5-day course. Don't decide after day 3, I feel good, I don't want to take medication, and quit it, because you are going to be causing trouble for yourself and for others very rapidly. The intake of dairy products, however, needs to be monitored and encouraged with appropriate consideration of specific antibiotics involved. And you do get different types of antibiotics. You get the broad spectrum, so it's a little bit like a shotgun or a machine gun that just fires at random and takes care of all bacteria. And then in certain cases, you will have doctors do blood tests or take if you've got an infected wound, for instance, they'll take a swab and work out exactly what sort of bacteria they're dealing with, and then can prescribe a specific antibiotic for that specific bacteria. In which case, in a lot of times, certain dairy products can be used in moderation and under direction between your doctor and your dietitian. Casein and calcium, which are both present in milk, decrease the absorption of ciprofloxacin. Now, some of these words are quite big and nasty, and forgive me if I stumble over them. I'm not very good at pronouncing drug names. Azithromycin absorption is decreased when taken with food, resulting in a 43% reduction in bioavailability. So you do sort of need to know the names of these antibiotics, but my suggestion would be, when you pick up your prescription, speak to your pharmacist. Your pharmacist studies pharmacology, which is medication. They should be able to tell you precisely when and how to take that medication and what to avoid when taking it. With no disrespect to the doctors, they are not trained in pharmacology. They get taught how to prescribe these things. Your pharmacist is the guy to tell you how and when to take them. Remembering that bioavailability is the absorption of whatever it is you're taking. Tetracycline should be taken 1 hour before or 2 hours after meals, and not taken with milk, because it binds calcium and iron, forming an insoluble chelate and therefore influencing its bioavailability. In other words, the absorption. The effect of milk added to coffee or black tea on the bioavailability of tetracycline was evaluated in healthy individuals, not sick individuals. Results showed that even a little quantity of milk containing extremely small amounts of calcium severely impair the absorption of the drug, so that the presence of this metal ion should be carefully controlled in order to avoid decreasing the available tetracycline. So in other words, don't have a cup of milk, coffee, or tea at the same time as you're having your tetracycline. Food-drug interactions may reduce the bioavailability of drugs taken after meals. In other words, a negative food effect. However, enteric-coated tablets, those that have got that special coating on them that start to disintegrate when they reach the middle to lower region of the small intestine, could reduce negative food effects. And in our products, like the garlic and the acidophilus, they have enteric coatings to let them dissolve in the small intestine, not the stomach. So that's why they have a better absorption rate there as well. Results indicated that food-drug interactions were avoided by separating the main absorption site of drugs from that of food components. Because food is swallowed and goes into the stomach to get broken down. So if your medication can go through the stomach into the small intestine, it does help and make a difference, because they are then absorbed in a different manner. The next thing is analgesics and antipyretics, and these are big fancy words for painkillers and treatment for fevers, because when you have paresis, that is a fever. And natural painkillers include things like garlic, ginger, organic grapes, peppermint, turmeric, etc. Analgesics and antipyretics are used to treat mild to moderate pain and fever. For rapid relief, acetaminophen, pardon me for the pronunciation, should be taken on an empty stomach, because food may slow the body absorption of acetaminophen. Co-administration of this drug with pectin delays its absorption and onset. In other words, don't have it with your marmalade. NSAIDs, which is non-steroidal anti-inflammatory drugs like ibuprofen, etc., can cause stomach irritation and thus they should be taken with food or milk. So whenever you pick up a prescription, your pharmacist will generally tell you to take it with food or after food or on an empty stomach. Please stick to that recommendation, because as we can see here, this is the reason why. Because you can either make your medication, my apologies, null and void, or you're going to cause a different reaction when it dissolves. You need to avoid or limit the use of alcohol, because chronic alcohol use can increase the risk of liver damage or stomach bleeding when you're taking things like ibuprofen. The absorption of ibuprofen and oxycodone, when given in the combination tablet, was affected by the concomitant ingestion of food. So in other words, when taken together with food, the absorption rate was affected. Can you mute, please? Yeah. The daily dosage and frequency of ibuprofen must be reduced when administered with Coca-Cola. Now, there's an interesting one for you. Food intake did not appear to affect the extent of absorption or the total exposure of oral diclofenac potassium, a soft gelatin capsule, at the doses prescribed. Now, bronchodilator is things that you would use when you have asthma, for instance. And you'll see now when we talk about caffeine, but this gives you a rough idea of how much caffeine per cup you will find in things like decaf coffee. Yes, decaf actually still contains caffeine, but compare a decaf with 3 milligrams of caffeine to your brewed coffee with 95 milligrams of caffeine. There's a significant difference. So that's where you'll find a lot of the caffeine. Now, as I've did some research recently on caffeine, and I might just do a talk on that at some stage as well. Caffeine is not always the enemy. It's the source and the amount. Any toxicologist will tell you the poison is in the dose. So it's the source of the caffeine, whether it's natural or synthetic, and the amount that is the problem. And the reason that I was doing research on caffeine was overseas. They've just launched a new energy drink with Neolife, which has caffeine. Now, bronchodilators like theophylline, albuterol, and epinephrine possess different effects with food. And as I said, bronchodilators are things that are used to treat asthma. The effect of food on theophylline medications can vary widely. High-fat meals may increase the amount of theophylline in the body, while high-carbohydrate meals may decrease it. Avoid alcohol if taking theophylline medications, because it can increase the risk of side effects such as nausea, vomiting, headache, and irritability. Avoid eating or drinking large amounts of foods and beverages that contain caffeine. And you will find caffeine in things like chocolate, colas, coffee, and tea, since theophylline is a xanthine derivative, and these substances also contain xanthine, which is a carotenoid. Hence, consuming large amounts of these substances while taking theophylline increases the risk of drug toxicity. You could end up poisoning yourself and landing up in high care. Additionally, both oral bronchodilators and caffeine stimulate the central nervous system. Patients may be advised not to consume GFJ, which, as we learned the last time, was grapefruit juice, when taking theophylline, since it increases the bioavailability and monitoring of plasma theophylline levels in patients consuming GFJ might be helpful in better management of patient care. And you are welcome to question your doctor on these things if in doubt. It's possible he doesn't know about it. It's possible your pharmacist doesn't know about it or forgets to mention it. So please never fear to question your medical professionals, because remember, they know an awful lot of information, but they cannot know everything about everything. So unless they're dealing with that on a very daily basis, it could be something that slips through the cracks. So if in doubt, if you are having to take this specific type of medication, please take note and ask questions of your doctor, your dietitian, and your pharmacist. Antihistamines. I know some people that take antihistamines almost like they're taking Smarties for various reasons, and they've got high allergy risks. It is best to take prescription antihistamines on empty stomach to increase their effectiveness. You do get over-the-counter antihistamines, as well as obviously the prescription ones. Either way, my suggestion is please read that insert. With every medication, even some of our supplements, you have a paper insert. Yes, I know it's bigger than an A4 and the writing sometimes needs a magnifying glass. Do yourself a favor, read that information, study it if you have to, and highlight the information that could put you at risk. Pardon me. Reputidine is commonly used for the management of diseases like allergic inflammatory conditions. Cimetidine is given with food to assist the maintenance of a therapeutic blood concentration. Pardon me. A fraction of cimetidine is absorbed in the presence of food, allowing the remaining drug to be dissolved once the gut is cleared. So this one has been formulated in the correct manner. Thus, therapeutic levels are maintained throughout the dosing interval. So the conclusion of this whole deal is a large number of drugs are introduced every year. And I saw an article, it was yesterday, that said something about this year so far, they've introduced another 23 new drugs into the system. That's just this year. So how many others have been introduced over the years since this particular talk was first put together a year or two back? Food and drug interactions can produce negative effects in safety and efficacy of drug therapy, as well as in the nutritional status of the patient. Generally speaking, drug interactions are to be avoided due to the possibility of poor or unexpected outcomes. As I said the last time, if you have one medication, it's okay. If you have another one medication, it's okay. But what happens when you put those two medications together? You don't know what that interaction is. How will it interact with you specifically? Because you don't know exactly how those things work in you specifically. And my example that I used for that the first time around was, if you have a hydrogen molecule and an oxygen molecule on their own, there's no problem. Hydrogen is a gas, oxygen is a gas. Now, what happens if you take 2 parts of hydrogen and mix it with 1 part of oxygen? You now have water. Water is not a gas. And this is the same sort of thing that happens with medication and or food, and can happen with chemicals as well. Like food, drugs taken by mouth must be absorbed through the lining of the stomach or the small intestine. Consequently, the presence of food in the digestive tract may reduce the absorption of a drug. Often, such interactions can be avoided by taking the drug one hour before or 2 hours after eating, because that is when your gut is empty. Like drugs, foods are not tested as comprehensively, so they may interact with prescription or over-the-counter drugs. Pharmaceutical companies test medication. They don't test medication and food. And this is the problem with nutritional supplements, such as ours, for instance, because our supplements are made from food. Now, how does food interact with you? Why do some people have allergies? Why do some people have intolerances of certain foods, whereas others have no problems? And the same thing with medication. Everybody is affected differently with medication. For instance, if I have a headache, fortunately very rarely, I can take 2 Panados and my headache disappears. Others can take 4 Panados and they may as well be taking Smarties because nothing happens. They have to take something significantly more potent. And the same goes with pretty much any medication. So everybody is unique. The authors would suggest patients to tell their doctors and pharmacists about their food intake and apologies, and dietary supplements so that interactions can be avoided. For instance, if you go to your doctor and he says, whoops, you have got a blood clot or varicose veins, and you need to be on warfarin. Tell them, listen, I am taking omega-3. What do we do? Because warfarin can clash with omega-3. Same thing if you're going for surgery. If it's an emergency surgery, please tell your anesthetist and your surgeon, listen, I take omega-3 on a daily basis and have done for some time. Because what's going to happen is they're going to have to watch your bleeding rate. They're going to have to be careful that you don't bleed too easily. And they're going to have to adjust the amount of anticoagulants or blood thinners that they give you post-op. Because if you're going for a joint replacement or a Caesar, they are going to give you, or any big abdominal surgery for that matter, they're going to give you an anticoagulant post-op because they don't want blood clots to form. But if you're taking an omega-3, they need to vary the dose because omega-3, while it doesn't thin the blood as such, it does make your platelets less sticky, which allows you to bleed more easily. A blood thinner thins your blood and therefore can clash, and therefore you could end up with a bleed that could lead to some serious implications. So just these little things, which we quite often forget to mention. How often do you tell your doctor what supplements you're taking? Does he even ask? That is where the problems come about. So this was a very brief overview. I've got a part 2 to this as well, which I'll start next week. But one's got to be so very careful about what you are taking and what and when and how you're eating it and how you're taking it. So what I'm going to start next week is some specific things to watch out for. So specifically the 5 dangerous food-drug interactions. And that I will do next week because I'd like to start that fresh next week and I've only got a few minutes left. So I'm going to stop my sharing. Does anybody have any questions or comments to make before I stop recording?